today?
Good, how are you?
Good. So I am going to go over your outpatient training. So it's my understanding that Carmen is going to be giving you your shots at home, correct?
Yes.
Okay, great. We're going to go over that today. She'll give you everything that you need, okay? So shots have been going good in the office, no problems, no reactions. Okay. Have you had any kind of asthma symptoms, wheezing, shortness of breath, anything like that?
No.
Okay, and you've taken your antihistamine?
Yes.
And you are not taking any medications that are a beta blocker, correct? And no other changes with your medications and no other injections in the last 24 hours?
No.
Okay, all right, and no visits with our doctors today in the office or telehealth, right?
No.
All righty. So we will go ahead and step over here and just go over all of the supplies that we have out and show you what we have for you, okay? Alrighty, and this packet, it will be yours to take home so you guys can read it more in depth. But have you ever given anybody an injection of any kind before?
No.
No? Okay. So we have directions here on where exactly to give the injections. So you can either do it in your arms or in your hips. Which location do you think you'll do? Probably arms? Okay. So this just tells about where exactly to give the injection in the arms. So you're going to give it at a 45-degree angle in the groove between the muscles, okay? So you don't want to hit a muscle, but we'll look on her arms before we do it, okay? Okay. And then this also tells you just about sterile technique and how to handle her vial. So she just have just one vial. And with one vial, you are going to rotate arms. So 1 week you'll do right, and then 1 week you'll do left. If you had 2 vials, you would do 1 in each arm every week. And if you had 3 vials, you would do vial 1 in your right arm, vial 2 in your left arm, and then vial 3 you would rotate in each arm, okay? And if you did have that 3rd vial, you would want to make sure to space it out far enough on your arm, okay? Alright, so this just tells about how to draw up the injection. So you're going to use rubbing alcohol. We have some cotton balls here to kind of clean off the top of her vial before you'll insert the syringe, and then also how to draw it up. We have this here, so it kind of tells you on the syringe exactly where you're going to draw up to. So her injection that she's going to get today is going to be at 0.25. So right here between the 0.2 and the 0.3 is 0.25 at that notch. And then whenever you go home, you'll be at 0.5. So that'll be right here, okay? So just that notch down there. Okay. And if you guys want to go ahead and do your injection, that's fine. So just make sure that you always perform some kind of hand hygiene, hand sanitizer, wash your hands at home. We also have gloves if you want to use those today in the office. But we'll draw it up first and make sure that you're comfortable with that, okay? Good. Always clean the vial off first. Good. Yep, you did a great job. So a lot of times whenever you are drawing up the syringe, you will have some air, some bubbles up top. You can always push that back up and then pull the plunger back down to get more out, okay? You can always go past what you're needing, and then you can always put more back into the vial. It's fine, okay? Okay. Alrighty. So before you give her injection, you will need to also clean her arm off. So if you want to grab a cotton ball, I will show you where at on her arm. So always make sure that your arm is relaxed. Well, that was more. That's okay. Alrighty, so just on her arm, it'll be kind of more towards the back, and then just make sure that you are not hitting any kind of muscle anywhere. So you'll clean it first, and then you can give her the injection. Good. Yes. Good, that's great. So you can pinch the skin like you did,
Okay.
or just do it without pinching. Either way, whatever's more comfortable for you is fine. And we do have a sharps container here that you can put the used syringe in. If you don't have a sharps container at home, you can use like an old laundry detergent jug, like a thick Tide jug, just something to put those syringes in, okay? Our syringes also have a little safety mechanism that you can push up that will cover the needle once you use it, okay?
Okay.
Alrighty. So this right here, this is her allergy vial order form.
Okay.
So it tells on here all of her information and then the day that her vial expires.
Okay.
It's very important that you don't give yourself a shot out of an expired vial, okay? So on the form, it does show you your date, your dose, and then where you're giving yourself the injection, and then you will also initial.
Okay.
So because there's only one vial, she's gonna rotate injection sites. The dose that you gave her today is the 0.25, and we will fill in the first few for you.
Okay.
So after the 0.25, the following week and every week thereafter at home, you'll do the 0.50 cc's.
Okay.
Okay? So with this form, just make sure that you send it back to us either through email or fax.
Okay.
2 weeks before the expiration date, which is listed here.
Okay.
Okay? All right, so if we don't receive this form for any reason, your vial will not be remixed. So send it in and make sure that you get confirmation that we did receive it, okay?
Okay.
Alrighty, so I have a couple forms I'm gonna have you guys sign before you go, just saying that you are taking your vials home and that you are gonna be injecting them for her. And then some more information that we probably went over with you before while you were doing treatment in the office, but we're gonna go over that again, is using an EpiPen. So if you were to have any kind of anaphylactic reaction, feeling like your throat was closing up, your eyes were swelling shut, you couldn't breathe, do you know how to use an EpiPen at home? Okay, so we will go over that. So we have an EpiPen, and then we also have an AudiQ. Okay, so same idea, you would use them in the same circumstances, they just work a little bit differently, okay? So with an EpiPen, if you needed to use it, always remember blue to the sky and orange to the thigh, okay? So if you take the blue cap off, that's your first step, and then just kind of with a swift swing into the thigh, you're gonna hold it for 10 seconds. It goes through pants, jeans, whatever you have on is fine, okay? So once you hold it for 10 seconds, you can release. And if you do need to use it, make sure that you call an ambulance or go to the ER afterwards, okay? Because you will need to be monitored further. Okay, and then with the AudiQ, same idea, you would use it for the same reasons, but whenever you take it out, it talks to you, okay? So it tells you what to do in the event of an emergency. Okay, it doesn't have anything to pull off of the top, but it does have something to pull off of the bottom. And it continues to tell you the directions of what to do. So you hold the black end to your thigh. You push it in, and you'll hear a click. And then it'll tell you how long to hold it in, okay? But same thing, make sure you call an ambulance or go to the ER if you need to use it, okay? So just based on your insurance usually or your pharmacy will depend on which one the doctor sends you in. If they do send in the AudiQ, it will most likely come from a mail order pharmacy, so be looking for a phone call from them to get your shipping information, okay, so they can get that to you. Any questions so far? No? Okay. And this just tells about our surveys. You may have already been receiving these as you've been in office, so this is going to come to your email once a week, just kind of to monitor the convenience, the cost, and the benefits of your shots, okay? So if you give us a score anything lower than a 7, we'll give you a call and see what we can do to help, okay? And then also the reasons that you would not be able to give yourself an injection at home would be the same as whenever you were in the office. So if you have a fever, if you're wheezing, you have tightness in your chest, if you've gotten another shot within the last 24 hours, if you've just exercised, or if you're taking anything that's a beta blocker, those would be reasons not to give yourself a shot at home, okay? Any questions about anything? Using the vial, the syringes?
So just to clarify, so with the syringes, once we are done, we can just put them in the laundry detergent bottle, seal it, and it goes in regular trash.
Yep, that's correct, yep.
And what do we do with the vials when we're done?
The vials, whenever you're done, you can just put those in the trash as well.
Okay.
You don't have to bring them back or anything.
Okay.
Okay. Also, we do sell the syringes here in
Okay.
office for a box of 25. It is $10.50, so you can purchase those at any time that you need them whenever you start getting low at home. Okay.
Okay. All right. Thanks.
You're welcome.